Year after year, election after election, candidates make promises about fixing health care and cutting costs. We're going to change how Washington works. Go back to Washington, and nothing changes.
I never said that we should try to go ahead and get single payer. What I said was that if I were starting from scratch, if we didn't have a system in which employers had typically provided health care, I would probably go with a single payer.
I happen to be a proponent of a single payer universal health care plan. No reason why the United States of America, the wealthiest country in the history of the world, spending 14% of its gross national product on health care, cannot provide basic health insurance to everybody. It says everybody in, nobody out. A single payer health care plan, universal health care plan. That's what I'd like to see. But as all of you know, we may not get there immediately. Because first we've got to take back the White House, and we've got to take back the Senate, and we've got to take back the House.
We are here today because we know that if we're going to make real progress this time, we've got to do things differently. Then they go back to Washington, and nothing changes.
When they're in charge, do what the corporations want. When they're not in charge, they don't stop the Republicans who are in charge, who do what the corporations want. Now, if you can perceive a difference from that, you're producing strips of money.
Now, I've got to be honest with you. The reason is because the big drug companies and the big insurance companies spent $1 billion over the last 10 years stopping reform from happening, writing another check, making sure that the lobbyists are getting their way, and the American people don't get any relief.
These health insurance companies, they have proven decade after decade they don't deserve to fund our health care system through our premiums because they make more money by denying claims. They have 30% of the dollars administrative, corporate expenses and salaries. Aetna is up to 30%. Medicare is 3% administrative costs.
I mean, how stupid is it when people say, oh yeah, that's all we need, the federal government telling Detroit how to make cars or Wells Fargo how to run a bank. You want them to look like the post office? Yeah, actually. You mean the place that takes a note in my hand on LA on Monday and gives it to my sister in New Jersey on Wednesday for 42 cents? Well, let me be the first to say I would be thrilled if America's healthcare system was anywhere near as functional as the post office. Truth is, recent years have made me much more wary of government doing the opposite, of stepping aside and letting unregulated private enterprise run things it is plainly too greedy to trust with, like Wall Street, like rebuilding Iraq. Like the way Republicans always frame the healthcare debate by saying healthcare decisions should be made by doctors and patients, not government bureaucrats. Leaving out the fact that health decisions aren't made by doctors, patients, or bureaucrats. They're made by insurance companies. Insurance companies, which are a lot like hospital gowns. Chances are your ass isn't covered.
We're talking about full Medicare for all, free choice of doctor and hospital. If you're part of an HMO, they assign you the doctor and hospital. So it's a preventive health care insurance system, full Medicare for all. Right now, Medicare is being perforated, undermined, sucked away under Medicare Advantage with 12% taxpayer subsidy so that the companies can undermine Medicare. Democrats don't want with that.
Throughout my career in Illinois and the United States Senate, I've worked to reduce the power of special interests and the power of lobbyists.
Among those gathered were executives from HMO giants Kaiser Foundation Health Plan and Health Net Inc., and the health insurance lobbying group America's Health Insurance Plans, from American Hospital Association, American Medical Association, from medical device companies, and from the pharmaceutical industry, including the president and CEO of Merck and former Congressman Billy Townsend, now president and CEO of Pharma, the massive industry lobbying group. Russell McIver, your take on this meeting?
Well, Amy, you had Dr. Quentin Young on your program in March. He's the founder of Physicians for a National Health Program and a friend of President Obama when he was in Chicago as a young politician and when he supported single payer. And Quentin Young called President Obama dishonest, and he is dishonest and the corporate Democrats are dishonest because they know that single payer is the only way that's going to solve this problem. And yet, they're keeping it off the table. And yet, they're cavorting with the health insurance industry, which should be put out of business. So this is the problem. The problem is not a question of everybody in this town knows what the answer is and knows this is going to be the answer. The problem is they don't want to confront it. They don't want to confront it because of the political power. And so we're going to force them to confront it. The enemy is no longer the health insurance industry or the pharmaceutical industry. The enemy is the corporate Democrats, the liberals and the corporate liberals in Congress who say they support health care for all, but are opposed to the only thing that will get us there. So that's why we're doing these actions, because we're directly confronting the corporate liberals, Max Baucus, President Obama, Senator Chris Dodd, and we're going to be doing this all over the country, and saying to them, it's time now that you put aside your ties to the corporate industries, to the pharmaceutical industry, and that you do the right thing for the American people.
We have doctors in this room right now that are going to take a seat at that table to testify in favor of Medicare for all and single payer. They should be at the table. You can't exclude what the majority of Americans want and the majority of doctors.
Committee will be in order. Committee will stand in recess until the police can restore order. David Mansky hosts the second of three roundtable discussions on health care in America. Committee will be in order to stand in recess until the police can restore order. Committee will stand in recess until the police can restore order.
Throughout my career in Illinois and the United States Senate, I've worked to reduce the power of special interests and the power of lobbyists. They will not run our White House, and they will not drown out the voices of the American people when I'm President of the United States of America. Year after year, election after election, candidates make promises about fixing health care and cutting costs. And then they go back to Washington, and nothing changes.
ProsperityAgenda.us.
Single payer action.
Yesterday, healthcare executives indicated to the White House that they were going to slow the rate of growth over a period of 10 years, thereby saving $2 trillion. Wake up, America. You have to look at the underlying numbers here. What it means is that their share of revenue for all healthcare spending is going to rise to $12.8 trillion by 2020. 1.5%, slowing the rate of growth times 10 years, 15%. You multiply that times your 12.8 trillion, you get about $2 trillion. This is a hoax. It is a swindle. They're trying to tell the American people that these insurance companies that make money not providing health care are suddenly going to give the American people a break when, in fact, the rate at which we're going to be paying is going to be 35% more than it is now. Wake up, America. The only plan that we can have that can work is universal, single-payer, not-for-profit health care. Break the chains, the shackles that these insurance companies have on our political process.
If high health care costs are the problem, some people in Pennsylvania say they have a solution. It's called the single-payer solution. Proponents say it would provide universal health care coverage at lower costs. And they rallied here in Allentown today to make their case for bringing it to the Keystone State. The demonstration was one of many held nationwide. Groups also gathered in Pennsylvania's capital to make their case for the single-payer plan.
Year after year, election after election, candidates make promises about fixing health care and cutting costs. And then they go back to Washington, and nothing changes.